Despite studies showing that tuberculosis has been around for centuries, it still remains one of the top leading causes of death on the planet. TB is a contagious infectious disease which is spread from one person to the other through air droplets when one coughs, sings, or sneezes. Simply put, as long as you are alive and breathing, you are at risk of TB.
TB as a project was funded from 2013 and has been running till 2018. We'll be closing out in November of 2018. This funding was to support the national level response to TB in Kenya. And the premise of the funding was really to support what was already seen by trends in terms of case numbers, a decline in the number of cases of TB in Kenya.
In July 2016, TB-ARC supported Kenya's Ministry of Health in rolling out a new diagnostic technology called GeneXpert.
The number of tests that have been done through GeneXpert has increased over time, and we've actually seen an increase in the number of bacteriologically confirmed TB, but in addition also of drug-resistant TB through GeneXpert expansion.
Through the enhancement of TB-Cash, we have had a faster turnaround time for meetings and supervision payments, as well as patient social support travel to health facilities for monitoring and receiving drugs.
We have got 5 patients who are on DRTB. All of them are getting their social support through TB-Cash. They get monthly.
To be able to trace the missing cases, the county coordinators had to undergo union training so as to capacity build them to understand how to interrogate their data and be able to break down to what is needed at the facility level.
Union training taught us that whatever we are generating can tell us what we are doing, how much we are doing, and how well we are doing. We were also taught about coming to the same facilities and make sure that the people they diagnose to have tuberculosis, they get the best treatment and they get the best outcome.
Partnerships were formed with international as well as local organizations such as the International Union Against TB and Lung Disease and Médecins Sans Frontières to deliver special trainings. Infrastructure support towards Project ECHO, an online teleconferencing technology, was also supported for cross-learning amongst TB professionals in Kenya, with several people logging into the weekly sessions from various locations around the country. Engagement of pediatricians in TB control activities and the launch of child-friendly TB medicine in collaboration with TB-ARC and TB Alliance is a milestone in childhood TB diagnosis and treatment in Kenya.
Children kind of were left behind a lot in TB control. 10 to 15% of the people with TB will be children. And the biggest challenge with TB in children is diagnosis. Children are not able to produce sputum. When they cough, they swallow. It's hard for you to get that sample for you to go and do a diagnosis.
With the support also from the counties, from the National TB Program, and one of our biggest partners, that is CHS, we were involved in quite a number of trainings and sensitization, especially when it comes to pediatric TB.
Among children, through our work with the National TB Program, we have been able to collaborate with even other agencies, other funders, to launch more friendly treatments for children. They would have to take lots of pills to treat their TB, but today it's a more soluble, palatable drug that they can take and actually get cured.
Corporate engagement through partnerships with Stop TB Partnership Kenya, members of private sector consortiums such as the Federation of Kenya Employers, Swedish Workplace HIV/AIDS Program, International Labour Organization, and the Central Organization of Trade Unions was achieved. They integrated TB workplace programming, awareness, screening, and testing on site in the endeavor of finding the missing TB cases, especially in men of productive age.
Senior management gave me the permission to allow CHS to come into place. Awareness was created employees were talked to, and thereafter we planned for the testing, we planned for the screening. The few employees who were found to be TB reactive are undergoing treatment.
We have supported public-private mix. It is noted that before a patient comes to a formal health facility, they may have gone to a private informal facility like a herbalist, traditional healers, or chemist to get the relief from the cough.
Mtu alikuja kuniambia ni Violet. Ndiye alikuja kwa nyumba na akanielezea, akaniambia watu wanataka watu wale wanaenda kujifunza kuhusu wale watu wako na TB. Nikajua vile mtu anaweza tumia madawa za TB na akue sawa. Na nikaonekana tena TB kwa upande wa dawa ya kienyeji mtu hawezi tumia na apone, mpaka lazima aende hospitali.
The Inter-County Gene Expert Sample Network transport is key in getting the sample from a distant health center to the nearest gene expert site to reduce the turnaround time for results of the gene expert tests. Depending on the vastness of a given region or the geographical terrain, different modes of private-public transportation were explored, like boat transportation, PSV transport by human transporters, G4S, and boda riders for health, which have proven to be very successful.
Using this program, we've been able to ensure that there are collaborative activities, both at national and at the county level. Each of the counties now have a TB HIV technical working group that meets on a regular basis, identifies all TB HIV issues, and make sure that the interventions for both TB and HIV are being coordinated in a collaborative way.
We salute our trained champions who cut across all levels of the society, from members of parliament to healthcare workers and former TB patients in their advocacy activities and use of their influence towards strengthening advocacy activities in reducing the TB burden in Kenya.
Hili ni jukumu letu sote. Lazima tujiinvolve, tujitokeze na tuiongee kila siku. Isikuwe ati wale wanaofanya stop TB ati sababu ndo wanafanya na TB ni wao peke yao.
Our desire to reduce the TB burden goes beyond healthcare to social and economic spheres. And we believe that TB ARC is a potent social force by itself and is uniquely empowered to make a difference in people's lives in Kenya and finding far-reaching solutions to enriching lives through innovation in healthcare every day.